just laugh anyway.
Yes. Hello, everyone. I'm Dr. Missy.
I'm Dr. Ariana.
And we're back with the Invincible Organ Podcast. Might be the name of it. We'll see.
Yeah.
Yeah.
Trying it out.
Yeah. So we're just here excited to share some more patient stories with you to just help understand how powerful this work can be and kind of talk through different patients that we see on a daily basis that we can support.
Yeah.
So, cool. So I personally started with this work, gosh, how long? It's almost been 9 years. Invincible's birthday is coming up.
Yeah.
So this was back when I was working at Project Move, and I was teaching a lot of mobility classes in the CrossFit world. So trying to teach injury prevention and just kind of sprinkling some of the organ stuff in, because I actually hadn't really taken that many classes yet. And I had this one athlete. So in the CrossFit world, a lot of overhead mobility is required. And this one athlete, we would do like shoulder, lat stuff. We would do T-spine, thoracic spine work in the class. We would do chest. We would even do low back, neck, and his like range of motion would never really improve.
Yeah.
And super strong athlete. Like he could press ridiculous amounts of weight overhead, but was still probably stuck, like almost missing maybe like 30 degrees of that end range flexion.
Dang.
So he would come to classes still kind of young, so would maybe be more sore than pain. I wouldn't say he was in the injury category, but he just wouldn't improve. But took him about a year to come in and see me. And in my head, I'm curious about his liver. Like that seems, because the liver sits a big chunk of the bottom part of our rib cage, mostly on the right side, but also on the left. And so if there's restrictions in the liver, oftentimes the thoracic spine won't open up, and that can limit that overhead position. So he finally came to see me, come to find out in his history that he had a severe sudden backup in the vessels in his liver. So had a big surgery. So one treatment on his liver, we gained 15 degrees of flexion in his shoulders.
That is amazing.
Insane.
Yeah. That's incredible.
I felt that was like the ultimate voodoo doctor moment. Where you're like, what did I just do?
Well, and even like, because probably earlier in your classes, treatment of the liver, I mean, we're looking at like all planes of motion. Yeah. Right. So transverse, how is it rotating? Yep. Sagittal, frontal planes.
Yep. The liver moves in many different ways. Yeah.
And its interaction with the rib cage, truly.
Yeah.
So.
Yep. Yeah. So if this is your liver, it moves three-dimensionally. Yeah. And so it moves forward and back, up and down, and then also medial, lateral this way.
Rotation.
And I couldn't tell you exactly what was limited 9 years ago, but mostly all of it. Yeah. Yeah. And so when you look at some of the self-care stuff we teach, that's not going to address as specific as our hands could.
Totally. Yeah. And even working on all those other wonderful things that you guys are working on, or that he knew to work on, right? With thoracic mobility or shoulder, lat stuff, low back. I mean, it still just doesn't account for such a massive piece of that picture. Yep. Which is amazing that we get to see that. Yeah. And work on that.
Yeah. And get more to probably the root. It was probably the bony structure, the rib cage and the shoulder that adapted to that liver tension. So,
and also just really cool to think about how that treatment likely then benefited diaphragm use, breathing, all those different
stress
things. Stress levels, neural regulation.
Yes. I bet his recovery was much better.
Yeah.
I just remember him sharing how much easier it was to lift weight, which when you look at an athlete who is on the younger side, maybe hasn't had a ton of injury, they're not looking at injury prevention. They don't really care if they can't lift their arms overhead to prevent injury. It's performance.
Yeah.
So the fact that he was able to go and lift heavier, that was a win. So,
and even just to kind of gain some kind of scope into this. So how long do you think you treated his liver for? Can you remember?
It was,
our treatment 10-ish minutes, maybe?
Yeah, max.
with like a 15-degree. I mean, it doesn't always happen that way, obviously, but pretty insane that something that effective, that specific can create such like real change in real time.
Yeah.
I actually saw this with a patient that I saw a couple weeks ago. I literally treated his liver for maybe 10, 15 minutes, and his main complaint was a lot of like imbalances with his squat, actually.
Okay.
And after that treatment, I mean, even still, I mean, it's been almost a month now, and he's like, his squat, he doesn't feel any of those imbalances anymore. So just pretty impactful.
Yeah. Was it back squat, front squat, or just?
It was literally all of general.
Okay.
Yeah.
Interesting.
General squatting. So pretty cool.
So just that ability to hold his torso upright, probably.
Totally. Gives you so much more, control over your core too.
Yeah. Mm-hmm. So, and that's kind of, you know, when I personally got started into the work, that's where the passion was teaching these athletes who are struggling, where the other things are not helping, that the organ system matters. So we continue to see that on a daily basis.
Yeah, absolutely.
And we love teaching those workshops at gyms too. Those are super fun.
The organs and athletes. Yes. Yeah. Those are our favorite.
Yes. We have one coming up at Nurture in March.
Yeah.
2023.
Yep. Yeah. Right around the corner.
Yes. So who did you want to share today?
We're going to chat about a patient that we actually share, which is really fun. That's one of the amazing things about our practice is we get to collaborate on a lot of patients, which really provides a well-rounded approach to a patient's care. Because we both obviously have different experiences. We've went to different PT schools. We, have whatever it is, studied kind of different avenues or kind of got here in different ways. So it's cool to get those two different experiences shared with some of our patients.
Yep. And have a second eye.
Yeah, exactly.
That's always helpful in the medical world.
So one of these patients that we're collaborating on, was she 24, 25?
Something like
that. Mid-20s.
Yeah, mid-20s.
Female. Long history of various traumas, dysfunction, gut dysfunction. I think early in her teens, she was mistreated for Crohn's disease, was given steroids that made things worse. She's had facial reconstruction from some trauma in her past. It's a wide variety of different things that she's experienced. And more recently, or more in recent times, over the past year or so, has had some pretty substantial changes to her bowel movements. She started presenting, or one of the main things that she was talking about is over the past year, her bowel movements or her stool has been primarily white or gray, opaque in color or like in texture, and struggles with a lot of constipation. So with our training, what we basically learn is that white kind of chalky stool is a primary sign of pancreatic dysfunction, right? And we don't see it very often.
And also very terrifying, can you imagine?
Yeah, and to be going on for a whole year. I mean, the pancreas is not an organ you want to just kind of mess around with and not get treated. So
and she had more like urgent care testing done, right?
Yeah, a lot of like urgent care type testing.
Okay, to make sure like you're probably ruling out cancer.
Exactly. Kind of a lot of like those big red flags. And a lot of it came back negative. I mean, and even just testing in general, she's had quite a bit of testing before she even came to see us. Still thinking that a lot of it is not as specific as we need, especially when we are concerned about the pancreas or pancreatic enzymes, pancreatic function tests, things like that. So she's coming in with all these complaints. Upon evaluation, getting a lot of tension carried around the pancreas, so starting to confirm that initial thought process that we're having. Primarily around the pancreas, the duodenum, and the biliary system. So you're thinking gallbladder, its relationship through that, its duct to connect to the duodenum, how the pancreatic enzymes then coincide with those, and how that impacts the body. And what's beautiful about our evaluation is the body tells us what it wants to be treated, right? We always say the body knows best. So we treat at that primary site. pancreas, gallbladder. That's what I worked on that first session.
Mm-hmm.
And what was pretty incredible is for 3-4 days following the session, she was having consistent, normal bowel movements. So
Normal color.
normal color, normal texture. When we think about the stool chart, right? It's like that typical 3 or 4 is ideal. So, I mean, 3 days, just consistent, great bowel movements, right? And then kind of went right back to that opaque white. So all through this, we're obviously recommending that she gets more testing, but continuing our treatment. Now we've seen her 3-4 times, 4 times now. And overall, even though we still haven't gotten that specific testing yet, which we're still encouraging her to do, overall seeing tremendous improvements in so many different areas of her life. Not only are bowel movements improving, it's more consistent, so she's less constipated. Texture and color is better, which is great. So showing us that the pancreas is ideally functioning better. I mean, that's at least where my mind goes.
Pumping better, more juices, digestive enzymes, breaking down food, absorbing
the
nutrients.
body's like managing stress maybe a little bit better, so on and so forth.
Her period
I was going to say her period has been improving.
She had horrible PMS, was vomiting during it.
That's been improving. And I think there was a couple other things, but generally what was just really amazing is the impact. I mean, over the course of about 3 months now that we've seen her bowel movements change, which is such a huge marker to us of what our work is doing and how the patient is functioning overall. And then additionally, there is that emotional component.
So when I've only seen her once, and I don't think either of us have seen her since I saw her last.
Not yet. I think I see her next week.
Okay. So when I worked on her, similar to our first conversation, if you haven't listened to that yet, we talk a lot about kind of the emotional piece, but I got a big emotional listening in her body. Her body was saying, please support the emotional system. And the patient was kind of already prepped for this because you had the conversation about that as well with her. And so it was all pancreas. And so we worked connecting, again, limbic system in the brain to that area.
And pancreas is typically associated
with grief. With grief, yes. So kind of talking her through the grief. And I'm glad you said that. So before we went into the treatment, I checked the pancreas motility. So that resting motility is that resting rhythm of the organ. So this is not a liver anymore. This is our pancreas. I'll face it this way. So as your organs are sitting here, they're constantly moving, not this big of a movement, but that's a marker of physiologic function that the organ's doing what it needs to do. So that's motility with a T. And so her motility was very sluggish of her pancreas too. So just another thing that we could test after. And I worked limbic system in the brain, reintroduced it to the pancreas, and helped release some of that stored emotional tension in her body. And what was interesting, she was very inquisitive, asking, what emotions it was related to. And she said what was coming up for her was not her own grief, but watching her sibling go through emotional grief, 3 significant things back to back. And so it was really interesting how it could be your own experience, but also how we experience other people's emotions and how important it is to not hold on to the weight of others. We want to lift people up and support people, but how can we do that and not absorb what they're going through?
Right.
So we actually had a conversation, again, not trying to be a therapist, but hey, maybe you could have a conversation with your sibling and ask them how they're doing. Because what if hearing that they've moved on might help you feel less stored or something like that?
Or seeing how they're processing through that time in their life. Yeah, absolutely.
Yeah. I think she even shared that her sibling tends to not talk about things and stuff things down. So they haven't really had that conversation. So whatever story her mind is going through about how her sibling's responding to it, that could be how she's holding on to it. So.
And then motility afterwards
improved.
Yeah.
It wasn't 100% yet. That's kind of how we'll gauge the change, is percentage wise. So it's not 100%, but we'll see.
But we're getting there.
Where it is. but just the ability of how to see how that emotional tension can actually be stored and affect the physiologic function of the organ.
Yeah.
That's what we're
Absolutely.
trying to help with. Yeah.
And then, I mean, again, what's amazing about our collaboration is working the emotional, working the physical, working all of those different areas of how we function ultimately is resulting in these improvements. I mean, it's just really, really cool how well-rounded it is.
Yeah. Yeah. So make sure you're looking at your bowel movements.
Yes.
I think
major takeaway.
Major takeaway. Look at it. And what popped into my head, this is pretty funny. I don't know if you're familiar, like when you go to Europe, a lot of the toilets have like almost like a plateau on their toilet. And so my friend Laura, who's going to be watching this, I was just in Europe with her last year, and we were talking about this because it can be, sorry for the graphic part, but it can be very messy because a lot of times the bowel movements will sit there, and when you flush, it doesn't go away.
Interesting.
So we were complaining about it. This is a friend who I know from California, and she moved to Europe. But she was talking to some of her friends who are from Europe, and they do that intentionally so you can pause and look at the health of your bowel movement.
Really?
That's what they teach their kids. That's the whole purpose.
That is so interesting.
Yeah.
That's incredible.
Yeah. So, and I think
we
most
need
of our
more
toilets
of that.
here are more like straight down, probably for
and just like don't see it, out of sight, out of mind, right?
Yeah. So look at your bowel movements.
Yeah, definitely.
Yeah. And it's the Bristol stool scale that you want to look at and kind of see.
Yeah, that type 3 or 4 is kind of ideal. Yeah.
So
pretty amazing.
You know, Europe's got a lot
really
going
cool.
for them.
We would probably do a whole nother podcast on just
looking
that.
at your poop.
Well, poop, and probably Europe. I mean, even like in regards to gluten sensitivities and all that.
Oh,
too.
definitely.
Yeah.
We promise to never show photos.
Yes,
or videos.
Never. No, or videos. Also alarming. Not going to happen.
No.
Yeah.
Anything else?
I don't think so.
All right.
That was it.
Yeah.
Amazing.
Thanks for hanging out.
Yeah. Thanks for listening again.
We will see you next time.